I have a wonderful lady from Texas, right? From the Houston area. So she comes to me. She had implants, 460 cc's and 420, done in 2008. And these were the saline implants below the muscle. Now, you are 4 days out from your surgery. Now, please let us know how you're feeling.
Amazing. I don't have hardly any pain.
So you're taking just the Tylenol 500 milligrams, right?
Yes.
Yeah.
At this point, it's only 500, and I'm not have to take it. I don't have to take it every 6 hours. It could be 8 hours, and I'm okay. And so I never took any of the strongest medicine for pain. Only Tylenol extra strength and Aleve.
Good. Very nice. Now, tell us how you have improved post-operatively from your symptoms of breast implant illness.
The recovery has been extremely fast, and I've seen improvements the same day of the.
What did you know this improvement was?
The first one was the pain in my feet. I had pain for the last year and a half, and I wanted to change shoes at least 3 to 4 times in a day, different type of shoes to relieve the pain.
So you had foot pain at the base of the foot?
Yes, on top and at the base and the ankle. So from the ankle down.
Got it.
And so the day of the surgery, the pain was gone. Okay. The night of the surgery at the hotel, I started feeling that my throat was opening, my sinus was clearing, and I was able to hear better because I had lost most of my hearing.
Yeah, no, I will tell you, this is exactly what the many other ladies echo as well. You know, they're able to, the throat clearing, sinus problems, the congestion, and then the inflammation in the ears, certainly. Now, keep talking. What else?
And so the pain in my hands, because the pain was severe for the last year and a half as well. No more pain in my hands, the swelling. And so the pain, it's nothing. The pain from the surgery, it's actually nothing compared to all the symptoms that we carry throughout the years.
Right. Now, one other thing I want to mention here is you also mentioned your rash is improved.
Oh, yes, I had a big rash around my mouth for the last maybe 5 years. And so, yes, it's improving. My skin has improved.
Right. Now, I'm happy to hear. Now, you did not need a lift. As you can clearly see, I cut out the excess skin, right? I am very pleasantly, as an explant surgeon, am very pleasantly surprised how well you have rebounded and recoiled well. And you certainly did not need the drains. Yeah.
Yes, I'm impressed as well. The way my breasts, they're already positioned like in a very... They look good.
Right. And obviously a lift would certainly be way too much and unnecessary, too much of a trauma / an insult to the chest on a day when the whole focus and emphasis was on the explant. Now, how did you find me out of what would be the 3rd largest city in the U.S., Houston?
On a Facebook page. I was desperate. Everything was so fast. I told my husband, I don't think I can work anymore. The pain is so severe in my body, and I guess I need to do a very radical change in my lifestyle, actually my diet, because I'm a very calm person and don't have much energy. But and so I told him I'm in so much pain, and so I'm gonna take some time off, and I'm gonna do some detox, cleanse, diet, whatever. And so I was already starting to do my cleanses, but he found a video about the BII in TikTok, and he sent it to me. And so I started doing my own research, and then desperately looking for the best doctor to help me. And so I did my research and looked in Facebook for BII support groups, and so that's whenever I found you and other doctors. But I went in a very thorough description of each technique that you use to help the customers. I mean, your patients, not the customer, but your patients. And so I really liked the way you help us heal.
Sure. And again, do as little as possible. In your case, less is more. No need for drains, no need for a lift. How was your anesthesia experience?
Very good, because I was really concerned about the anesthesia.
Yeah, you were, of all the patients, the most concerned. I was too. Remember, I was texting you, I was talking to you. You're given your history. You have an arrest post-operatively in recovery in 2008 when you were just 27. And the concern was if you were safe for my surgery center because you given your history. Yeah, please keep saying.
Yes, so whenever I did the breast augmentation back in 2008, I had a respiratory arrest and I died, and I was in induced coma and life support for 3 days. And so I wanted a doctor that will help me during my the healing process.
Right.
And so that's why I said I look for every technique that you use for this process. And so you were the perfect candidate.
Sure. No, again, you had 14 years of proof that your heart was good. That was purely a respiratory / anesthesia issue given your last surgery. And we got feedback from Dr. Rasby, who's your primary internal medicine doctor who knows you for 5 to 6 years. My anesthesia team, my nurse, we literally went page by page, line by line, and we saw no reason to not do your surgery at the surgery center versus at the hospital. Just given your young age, and this is where you were cleared, and mentally and physically you had all the safety checklist met criteria to do the surgery at the surgery center. Now, one last question on my end, and then please tell us anything what else you want to say. What would you say to the other person, to the FDA, to the other person that this is all in your head, that this is just the good Michigan water and the Michigan air?
No, it's so sad realizing that these big companies, they don't care. They just want their money, and they don't care for other people, how they feel. It's like playing mind games, and it's not fair. It's not fair trying to manipulate masses of people just to get money.
Sure, no, I agree with you. It is sad and it is a shame, unfortunately. No, thank you so much. God bless you. I have to say, you have a wonderful family, your husband, your 2 daughters who are here, and you have the best support. This is, I will tell you, priceless. No one can appreciate this any more than I, where your husband showed you the TikTok video, and he is on a quest to get you healthy and better and smiling again, and that is too strong. No, thank you very much.
Thank you, doctor,
Thanks.
for all your patience and your help.
Thanks.